When it comes to the world of health and wellness, few beverages have captured as much attention and admiration as green tea. Lauded for its antioxidants, linked to longevity in various cultures, and often promoted as a gentle pick-me-up, green tea has become a daily ritual for millions. But recently, a new concern has surfaced. Does drinking green tea cause urinary leakage? This question has raised eyebrows and sparked curiosity, especially among those who already deal with bladder sensitivity or are simply conscious about their health. Let's explore this topic in depth, sifting through myths, facts, and everything in between to give you a comprehensive understanding of green tea's impact on urinary health. To start, it's important to understand what urinary leakage or urinary incontinence actually means. Urinary incontinence is the involuntary leakage of urine, which can range from just a few drops when you laugh or sneeze to a sudden, uncontrollable urge to urinate that doesn't leave you enough time to reach the bathroom. This condition is more common than many realize, affecting millions of people worldwide, especially as they age. There are multiple types of incontinence, including stress incontinence, urge incontinence, and mixed forms. Each has its own set of triggers and underlying causes, from weakened pelvic muscles to overactive bladder muscles or neurological conditions. So, where does green tea fit into this picture? The answer lies in the unique composition of green tea and how its components interact with the human body. Green tea contains caffeine, though typically less than coffee or black tea. It also boasts an array of bioactive compounds like catechins and theanine, believed to contribute to its health benefits. However, caffeine, even in moderate amounts, is known to have a diuretic effect, meaning it can increase the production of urine. For some people, especially those sensitive to caffeine or those with pre-existing bladder conditions, this can lead to more frequent trips to the bathroom. But does increased urination necessarily translate to urinary leakage? The answer is more nuanced. While caffeine can indeed stimulate the bladder and may increase the urgency and frequency of urination, this doesn't automatically mean it will cause leakage in everyone. For individuals with a healthy bladder and no prior issues with incontinence, drinking green tea in moderation is unlikely to cause problems. However, for those who already have an overactive bladder or weakened pelvic floor muscles, the mild diuretic and bladder-stimulating effects of green tea's caffeine could potentially exacerbate symptoms. Let's delve deeper into the mechanisms at play. The bladder is a muscular sac that stores urine until you're ready to release it. Normally, the bladder fills gradually, and when it reaches a certain point, nerves signal your brain that it's time to go. The muscles around the urethra tighten to keep urine in until you're ready. In conditions like overactive bladder, these signals can become dysregulated, leading to a sudden, uncontrollable urge to urinate. Caffeine, present in green tea, can stimulate the bladder muscle, potentially triggering these urges prematurely. Research supports this connection, although the evidence is not black and white. Several studies have examined the relationship between caffeine intake and urinary incontinence, with varying results. Some studies suggest that high caffeine consumption is associated with a greater risk of incontinence, particularly urge incontinence. However, these studies often focus on caffeine from all sources: coffee, energy drinks, sodas, and tea, making it difficult to pinpoint the effect of green tea alone. Moreover, the caffeine content in green tea is relatively low compared to coffee, so the risk may be lower when drinking green tea in moderation. In addition to caffeine, green tea contains other compounds that may influence bladder function. For example, the catechins found in green tea have anti-inflammatory properties and may offer protective benefits to the urinary tract. Some research even suggests that green tea extracts can help combat urinary tract infections due to their antimicrobial effects. This dual nature, having both potentially irritating and protective components, makes the relationship between green tea and urinary health complex. It's also worth considering individual variability. Some people are more sensitive to caffeine and other stimulants than others. Age, gender, genetic factors, and existing medical conditions all play a role in how the body reacts to green tea. For older adults, who may naturally experience weakening of the pelvic floor muscles or age-related changes in bladder elasticity, even a small increase in bladder stimulation could tip the balance toward leakage. Similarly, women who have gone through childbirth or menopause may have an increased risk due to changes in pelvic anatomy or hormone levels. With all this in mind, what should you do if you enjoy green tea but are worried about urinary leakage? The key is moderation and self-awareness. If you notice an increase in urinary urgency, frequency, or leakage after drinking green tea, try cutting back on your intake. You might also consider switching to a decaffeinated version, which retains many of the beneficial compounds without the stimulating effects of caffeine. Staying hydrated is important, but you don't need to overdo it. Excessive fluid intake can also contribute to bladder overload. It's also helpful to keep a bladder diary for a few days, noting when you drink green tea, how much, and any changes in your urinary habits. This can help you pinpoint whether green tea specifically is a trigger, or if other factors, like stress, certain foods, or overall fluid intake, are contributing. Remember, everyone's body is different. Some people can enjoy several cups of green tea daily without any issues, while others might notice a difference after just one cup. If you do experience persistent urinary leakage, it's important not to jump to conclusions or feel embarrassed. Urinary incontinence is a medical condition, and many effective strategies can help manage or even resolve it. Pelvic floor exercises, often called Kegels, can strengthen the muscles that support the bladder and urethra. Bladder training techniques, which involve gradually increasing the time between bathroom visits, can help retrain your bladder to hold more urine comfortably. In some cases, your healthcare provider may recommend medications, physical therapy, or other interventions. It's also prudent to look at your overall diet and lifestyle. Other foods and drinks, such as spicy foods, citrus fruits, artificial sweeteners, and carbonated beverages, can also irritate the bladder in some individuals. If you're experiencing urinary symptoms, consider an elimination diet to identify possible triggers. Balancing your fluid intake, maintaining a healthy weight, and staying physically active can all contribute to better bladder health. In summary, the connection between drinking green tea and urinary leakage is not a simple cause and effect relationship. For most healthy individuals, enjoying green tea in moderation is unlikely to cause urinary incontinence. However, for those who are sensitive to caffeine, have pre-existing bladder issues, or are at higher risk due to age, gender, or medical history, green tea could potentially exacerbate symptoms. The best approach is to listen to your body, make adjustments as needed, and consult a healthcare professional if you have concerns. Green tea remains a beverage with many proven health benefits, from supporting heart health to providing antioxidants, and possibly even reducing the risk of certain cancers. It has been cherished in cultures around the world for centuries, not just for its flavor, but for its role in rituals of mindfulness and relaxation. If you enjoy green tea, there's no need to give it up out of fear. Simply enjoy it mindfully, pay attention to your body's signals, and remember that moderation is key. For those with sensitive bladders, making small changes like choosing decaffeinated green tea, limiting other bladder irritants, and practicing good bladder habits can go a long way. And if you're ever unsure, don't hesitate to reach out to a healthcare provider for guidance. With a thoughtful approach, you can continue to enjoy the benefits of green tea while prioritizing your urinary health and overall well-being.